Hi, my name is Dr. Caitlin Testa, and we're answering some common foot and ankle questions that we get here at Essex Union Podiatry. So the next one is in regards to heel pain. A patient's primary care doctor dismissed their heel pain as just wear better shoes. It's been 6 months and they can barely walk to their car in the morning without wincing. At what point does heel pain come from something that they should tough out, or is it something that they might permanently do damage with? 6 months of morning heel pain isn't something they need to tough out. Your concern is clinically valid, and that advice about shoes missed the underlying mechanism entirely. What you're describing sounds like a classic plantar fasciitis. Sharp pain with your first steps that may improve slightly as you walk, but here's what's actually happening with your foot. The plantar fascia is a thick band of connective tissue that runs from your heel bone up to your toes, and it's experiencing repetitive micro tearing at its calcaneal insertion point. Each morning, those tears have partially healed overnight, and your first few steps, they kind of recomplicate that issue. 6 months of this cycle, it creates something worse. You get a plantar fasciosis. The tissue degenerates rather than it heals, and collagen fibers that should be running parallel become disorganized and run perpendicular. That band thickens and it becomes painful and it weakens structurally. Here at Essex Union Podiatry, we take x-rays, we clinically evaluate the patient to see whether or not they're forming calcium deposits and they have a heel spur, or do we do an ultrasound and see if they have degeneration patterns and thickening at certain areas. Plantar fasciitis is a very, common thing, and the different treatment options change from patient to patient. So seeing us here when it first begins will kind of guide us and let us come up with a plan that can sometimes help the pain resolve a little bit quicker than if you tough it out for 6 months. So don't feel like you have to tough heel pain out. We have ways to fix it and we have ways to make you feel better.